Hello, everybody. Welcome to the Han International Days. The first talk about movement for movement with Anne Gates. Though, unfortunately, today it is today without Anne Gates of Exercise Works. Anne Gates, unfortunately, Anne became ill. So she couldn't make it today. So she's postponed and will be here tomorrow. So she will join us tomorrow in this kind of meeting. But today you have to do with us. So we together will try to help you and provide you with the challenge. Because for those of you who don't know, Anne has been involved quite a lot with an Erasmus Plus Vanguard program, Movement for Movement. And this is a way to promote physical activity for all. It's a global action plan towards physical activity. The thing what we are going to do today, we're going to present you the challenge. And the challenge will be for 48 hours. So after 48 hours, we managed to go through this together. Do we like it? Yeah, we do, isn't it? Yes, great, great. Okay, so I will start presenting. I'm almost start presenting.
Maybe then a nice thing to know, so Joost can start up the PowerPoint. The energy what Joost was just doing, like, yeah, it's really like Anne. So I hope maybe that she's here tomorrow and you can see the energy from Anne, also what Joost was representing.
Thank you, Els. So in line with Anne, we try to move you through it. What we're going to talk about is university and student leadership on interdisciplinary learning for health and well-being. It's a movement for movement concept, and actually we are a movement and we try to help, or not even try, we activate, we advocate, and we do help people to start moving more. What will be the future drivers to ill health, inactivity, immobility, and premature mortality? Those are the questions that we a lot of times we work upon as healthcare professions. So what will it be? How it will go? We definitely know that non-communicable diseases, the NCD, cause quite a lot of problems. 7 in every 10 deaths in the world from often avoidable causes. So we talk about cardiovascular disease, chronic respiratory diseases, cancer, diabetes, and mental health conditions. This is something that we actually can do something with. We also have a lot of agencies for, like in this case, it's the NHS, it's the English version of it, so that we know what's really happening there. And it's one of the bigger parts that we constantly have to work on is equality and equity. Our ideas concerning health justice and fairness, what it actually is. So most of the time we talk about equality, gelijkheid, or equity, which is a more proper thing, which is more gelijkwaardigheid, which in Dutch, which means that we have to look upon every person, what are their abilities, their application. So it's more their capabilities. So it's not only like everybody is the same. No, we are heterogeneous population. Everybody is unique. So we have to create a kind of a solution for every one individual. So serving the individual, and that is equity. So there's a lot of things that we have to take care. Then also we have to deal with how are we as healthcare professionals being able to support those people who need the support. Well, that's something that's constantly happening right now, right these days, that we talk about it in COVID-19, how we can support the healthcare professionals. It's something, this is kind of the big question at the moment. Then we talk about complexity, ambiguity, challenges, sense-making, moral agency, urgency, partnerships, working as diverse, interdisciplinary, interskilled teams. It's quite a lot we have to work with. So if these things are the future drivers to ill health, inactivity, immobility, and premature mortality, there's some big challenge awaiting us that we have to go for these and we have to start working on them. This is the same thing when we look upon COVID. Well, everybody knows directly the frame that we see. We need, in this case, we need a stronger collaboration for better health. Oh, sorry. A stronger collaboration, better health, global action plan for healthy lives and well-being for all. It's a It's written by the WHO 2020. I probably have seen it before. It's hanging in praktijk coaching in some of the places of physiotherapy. A global action plan for healthy lives and well-being. So that means that we have to look upon the SDGs, the Sustainable Development Goals, the NCDs, the non-communicable diseases, and healthy aging implications for the nations, systems, and individuals. So we have to look upon these different tracks constantly together. That makes it also quite important that healthcare professions, as we all are, can be change agents. And we have to think about make every contact count. It's not just being there one time. Every time that you meet a person, you have to be there. You have to support, you have to find something. And that means healthcare professionals can encourage physical activity by mentioning physical activity in all consultations, encouraging older people, patients, and those with health conditions to stay or get active and avoid being sedentary, sitting for extended periods of time. Definitely important right now, right here, where we sit so much of today. So we have to force each other and help each other to start moving. All moderate intensity activity benefits health and differs by individual. Make it achievable and build from where the person is today. So that means it's not only saying about sports, it's everything that counts. And thinking about how your clinic settings can help promote activity during active travel plans for staff and patients. So for example, not only setting the parking places as close by as possible for the staff, maybe put them 100 to 200 meters away so they can have a little bit of a walk culture. An adequate medical health school changes what you know, but a great school changes who you are and how you behave. So this is something that we're going into right now. So it's no longer that you and we as healthcare professionals or future professionals or future healthcare professionals of upcoming occupational physiotherapists and other kind of therapists, that we are consumers of an educational product. No, we are part of the bigger picture. We are right now, we are part of this huge community of change, and together we make this change happening. It's not just being there and waiting, oh, just wait and see. No, staying up active and go for it. So a great school changes who you are and how you behave. And that is the thing that we have to go for. And that means, again, make every contact count when we talk with each other. In that case, we have the purpose of each university is to achieve success for health through physical activity for all to access and to enjoy. Global goal to reduce physical activity by 2025 by 10%, by 2030, 15%. And this is agreed by the World Health Organization, member states, and the United Nations. This is a huge goal, so we have to take into account. Within 4 years, we have to reduce physical inactivity by 10%. And then we have to think of that most of the people right now are sitting behind the desk, like we all do, in order to watch this one. This is kind of inactivity. Well, maybe we can put now already our chairs behind us. And we can do this kind of same presentation in a squat position. See if we manage and how long we can go. Yeah. Maybe I'm the first one to give up. Never knows.
Not everybody is sitting like this.
The movement for movement resources roadmap for physical activity, health, non-communicable diseases, NCDs, surgery, and pregnancy. This is actually the thing that we commit with today. So we follow and share the discussions, follow the hashtag movement for movement, and you can find it on Twitter, on Facebook, on Instagram. So use it everywhere, hashtag movement for movement. And the essential classes is the essential P1, preliminary 1 and 2, your leadership on physical activity for health and well-being. Then we have essential P4 and P3, P4, how to connect with patients and the public on physical activity and health. I think that most of the people need to have that chair back again.
Or just stand up.
Yeah. Then essential P5, P12, 7 slide sets on physical activity and key NCDs, non-communicable diseases, as you know, and surgery. Desirable P13, P21, 10 slide sets on physical activity and NCDs and pregnancy. And a desirable P22 global NHS school for change agency and leadership models. Then we have a recommended P23 taxonomy module on physical activity and health. All these materials will be made available for you. And if it's not within your own university of right now, please send us a message and you will manage to get them. As you can see below this link and below the YouTube channel, you will find a Dropbox link in which you can find the essentials P1 to P4. And those are PowerPoint presentations. It's of utmost importance that you go through them in slide mode, like the same thing that we do right now. Otherwise, you will miss half of it. It's really important. So it's a self-learning or a group learning or community learning based thing. The shared purpose of interdisciplinary learning. You see what's happening with physical activity. I'm standing in a squat position for some time and out of breath. It's something really, so my health is not that good anymore. So, but everybody knows, so it's something to gain, huh? Thank you for helping me and supporting me right now, right here. So an overview aim is to understand the health benefits of regular physical activity across the life course and influencing beyond health and societal systems. That means that we need knowledge, skills, and change agency are essential learning criteria. 1, to be aware of your professional role in strengthening system-wide influence and socialization of physical activity, including social prescribing, to change agency and moral agency. 2, to understand how physical activity can prevent and treat non-communicable diseases, prevent immobility and premature death. And 3, to understand physical activity within the context of health, sustainable development goals, determinants of health, and NCDs exploring the World Health Organization evidence, WHO, for action. It's the E4A approach. So we get there. 4, to be aware of the current physical inactivity levels and inequities in the global, national, and local populations. And 5, to understand the importance of very brief interventions such as making every contact count in key health conditions and vulnerable inactive populations, as well as an introduction to the skills required to affect change. 6, to understand the role of the family carer support and lived experience within the daily life of a patient, individuals, and advocate for better access and equity. Again, equity. And 7, to consider the WHO and national recommended physical activity guidelines and context within your day-to-day clinical practice and future leadership. That means quite a lot that we have to do. So it's not just a small task that we commit ourselves to as becoming and being a healthcare professional. We have to support each other because we are the social influence already there. And that's also the thing that we have to go for in classes and in groups to support each other. A kind of social prescribing of physical activity for small things. Help each other to use the stairs instead of the elevator, for just one example. That means also we have a shared purpose model for strengthening patient and population physical activity impact. And to be honest, now I really have to look what's meant here. So if we go here from competence, from the down under, then by change agency and capacity building, we will create more knowledge and skills. And by practice and assessment of skills and of influence, we build the capability. The difference between a competence and a capability most of the time is that the capability means competence in uncertain and unfamiliar context. That's the thing that we have to work upon. It's not just competence in the places that we know how to work. We have to be ready for the places that we don't know, because they are the questions of our clients and that's the questions of society. That means that we have to strengthen our confidence by system change in the prevention and treatment of ill health and impactful bedside to boardroom clinical influence. We are creating a clinical and social leadership. This definitely means, and this especially this last step, it doesn't end up with the one individual client. You have to take responsibility for what you see. If you see an environment, or you see not only the bedside, but also the boardroom, or in a communal center, or in a provincial, or national concerning elections. If you see something was happening there, I think that you have this responsibility based on this guideline to start acting upon it. It's not something that you can leave behind when you're not being a physiotherapist or being a healthcare professional. It's all along the way. Every contact counts, so every influence matters. So influence is the thing that we are. We are influencer advocates for physical activity. Developing your change agency at the systems level for physical activity, making every influence matter. So more focus on networks, communities, informal power, directions, and making system change happen. That means in this case that we have to establish those networks. We have to see where are the people, how we can connect. We are not living in a vacuum. Also what this morning Ben was talking, everything happens in an environment with people. So we have to know the environment, we have to know the other people. So we have to connect and start to collaborate. Collective agency occurs when people act together, united by the common cause, harnessing the power and influence of the group and building mutual trust. It increases the likelihood of bringing positive disruption into the system for faster change and bigger outcomes. Again, it's the collective agency, it's the collectiveness. We are doing it together. So every time that you think I'm just a one small, tiny bit of sand, but that tiny bit of sand together makes a huge stream. The togetherness is the thing that drives us forward. And we are, because we as healthcare professionals, we are one of the largest professions in the world. If we connect all those healthcare professions, and the only thing that we have to do is make every contact count. So that means less formal change management, but more choreography, more virtual connections, see what we can do using influence challenge. Identifying and working through super connectors. Who are the super connectors and make things happening? Young leaders are at the heart of change. Well, now I really get happy because I'm not a young one and I'm not a leader either. So I'm quite old. I'm not a leader, I'm just a person, but I know most of you who are now listening here, you are the young and leaders. You will make this, going to make this happening. So you will create more change platforms. You will get led and less top down or bottom up. So we're going to move it in, we're going to spread the word. So more 30, 60, 90 day cycles. A less 1 or 2 year change program. So it's not so much about planning for the long run. Okay, what are we going to do next year? No, what are we going to do tomorrow? Today, right now. That's the most important part. Why wait when you can start doing something? And by the planning, you know it will take over. So we have to start moving. The examples of brief interventions model for physical activity for individuals in any provider service, any country in the world, are the MECC 3A's approach. Examples 2 and 6 will be shown in plenary 4, so it's not there yet. Follow your local and national healthcare organization guidance on brief intervention approach. See some video examples here. We're not going to go there, you can do it another time. It would be nice if you can record brief interventions as part of routine practice so that change effectiveness can be evaluated to show a skill implementation, for example, like smoking cessation advice. This means that whenever you think about some small intervention that you can take right now, right here, within an hour, within a moment, that you talk about it and see what's happening there. The 3 M's, make it a daily habit. Being inactive is harmful to health, and don't be still for too long. Those are essential clinical health messages for adults with disability. Those are quite important. Even the way of telling them has been a part of research, and it makes sense that those 3 messages are the most important one to translate in our own language, for example, Dutch, Turkish, Portuguese, and Norwegian, so that we start to using them, because it's also the way how to pronounce the words and the way that the message is conveyed is important. So make it a daily habit. Make physical activity makes you feel good. Give things to a go and enjoy what you do. Help chronic diseases. Improves, and being inactive is harmful to health. And balance makes daily tasks easier. And encourage movement and coordination within abilities. Every little movement is better than nothing. And the most important piece of advice my neurologist gave to me was, the best thing you can do in this situation is to start exercising actively. And I'm happy I paid attention and marked the doctor's words. I've been living by these instructions for a few years now, and it has been worked out very, very well for me. And I think most of us know it. Well, maybe not all of you, maybe all of you who have had this kind of life experience, longer life experience, what you have when you are 48 years old, and then you think, well, I have to start moving, because it's so easy to have this sedentary lifestyle that you just sit there, take the car, take the bus, drive as little as possible, do as little as possible, sit in your chair and think, oh, I'm tired. The thing what helped me actually is to start exercising, to start cycling, and to emerge again with more and more swimming, and actually to love the way of going into the deep, deep, cooled water. So exercise in dementia. It's nice to read this Pietri Lampina story. So putting the guidance into everyday clinical practice. So the guidance is not something real, it's something which is connected to things. The potential for interdisciplinary undergraduate education, it has to be inclusive and diverse physical activity advocacy. So so individual assistant with complex needs, visit to the GP, general practitioner, nurse, or the healthcare practitioner. Healthcare practitioner refers to physical activity services, and one or more paths to engagement. And this is something here we have to see from what kind of relation can we build up here. So, and we have to go for system and individual outcomes from improved health, improved well-being, improved work opportunities. So make every contact count, and every influence matter links people into community support to help them improve their quality of life. And we can find those examples and we can make them, because we have to be a little bit creative and see what we can do. So that means that we have to go for change agencies, or improving partnership and collaboration skills, connections. So we have to figure out what kind of the connections can we build upon, developing community or practice networks and professional links. We have to engage in conversations like we try to do right now, today, not now, because I'm just having a conversation with me with this slide set, which is a different kind of conversation, but it's actually nice to have a conversation with all of us, and engaging with a range of activities from confidence to social networks and well-being. So learning that fosters working together at the start. Leadership that strengthens systems and delivers safe, effective, personalized care. An agency that promotes and protects the health of their patients and populations. The challenges for all of you, and now gets the tricky part. For day one, review the resources plenaries P1 to P4 and slideshow mode only. And then got the question, consider how could your group add value to the resources by demonstrating implementation of knowledge and skills, see the quiz. And identify an area of change agency for physical activity that you could lead on. Those are the challenges for today. And tomorrow we will go back to you with day 2, what change agency leadership methodology we use. And in day 3, we definitely look upon what have we achieved. And then we made a difference. So that was a long talk. How do you feel? Are you opening to this challenge? Yes? We're going to take the challenge? Then I would say, go into the documents, go into what it is, and then we will see each other tomorrow at 1 o'clock Central European time.